Perfect. Hello, Assalamu alaikum, bonjour, all of you, lovely people, lovely Casablanca, and my first time in Casablanca to be presenting something very exciting. So today, what we are going to do is we're going to go and embark on a journey together. This journey is about something that we all have questioned throughout our lives. It's the journey of aging. Well, as I can see you around, and I can look around, all of you are very young-looking, lovely-looking people, but aging is one of the enemies that we are trying to combat every day in our field. So as we are talking about aging, I'm going to take you through a journey of aging and how we came to the conclusion of a liquid PCL revolution. And that revolution is something I'm really excited to introduce you all to today. So let's go back to the aging elements. So what are the aging elements of the skin? The aging element of the skin are epidermal changes, structural loss, reduced hydration, and volume loss. Now, if you look at all these stages of aging, what you would recognize is that collagen loss is the actual main contributor fact to the skin aging. Now, we keep talking about collagen all the time. So can anybody quickly tell me how many types of collagen do we have? Anybody? How many types of collagen do we have? We have got a lot of dermatologists in the house. Yeah? How many? 6, okay. Anybody else? 5? Anybody else? So everybody in Morocco has got different types of collagen, right? So we have established that. 28 types of collagen are there, right? And out of those 28, which one are we concerned about? 1 and 3. Perfect. So 1 is the one that makes 90% of the skin, nail, and hair. Now, 3 is the one that actually gets induced when there is a trauma to the skin and also complements with the type 1 too. So now we have established that part. What does collagen really do? In the layman terms, if you have to explain somebody, what does collagen do? What are you going to say? I'm a layman. So if I come to you and say, what does collagen do? So how do I explain is this? The collagen is an anchor that goes under the skin like that, and that keeps the skin in place. The lesser the collagen anchors, the more the skin will sag. So there will be a saggy skin, and as we are aging, as you know, the skin comes down, forms the jowls, forms the nasolabials, forms the marionettes, and that's exactly what we are combating, okay? So once we have established the skin aging, may I also again emphasize that collagen depletion is one of the biggest causes of the aging element that we see on the face. Although there is a loss of fat, there's there's bone resorption at a certain age, and also other elements that contribute to their facial aging. But collagen remains one of the main contributing factors for this facial aging to occur. Now, where is collagen formed is the key component. So the collagen is formed by the fibroblasts. So technically, what we have to do is initiate that collagenesis process within the fibroblasts. And that is what we want to achieve. Now, this brings me back to why we are talking about collagen, why we are talking about aging. So I'll tell you from my own experience today. In my clinic, about 98% of my clients are now filler-free. They don't go for the fillers. And all the clients who are getting a bit more educated, and especially the higher-paying clients, and 30-plus clients, they want to have natural rejuvenation to their skin. They want the natural collagen to come back. They want to look the youthful version of themselves instead of altering themselves. So that there is a big paradigm shift in aesthetics now, going from masking by fillers, masking by other elements, to actually producing collagen and bringing back the youth that you once had. Does it make sense? Is it the same trend all around the world? Because I feel there's this trend as we are going for. So once we've established that collagen is what we need to produce and fibroblast is what we need to be initiating the collagenesis process in, and understand the fibroblasts actually form the extracellular matrix, which gives a network that collagen can grow on, this is what we have to do. So Going back to the types of collagen, type 1 and type 3 are the ones that we are normally worried about more. Other types are there. 2 and 5 are the ones that we also mention in a lot of other cases, but the actual types are way more. So now, this brings us to PCL. Now, every time I speak about PCL, people think I'm talking about something new. Well, it's not something new. It's more than 90 years old. So basically, if any one of you has been in plastic surgery or has done their fellowship in surgery, they would realize that the absorbable sutures are made up of PCL, which is polycaprolactone. So where does PCL come from? It's a class of biodegradable polymers, which is polyglycolic acid, which used to be used before, PGA, similarly PDO, polydioxanone, PLLA, polylactic acid, and PCL. So basically, PCL is just the latest, more effective version of all these biodegradable elements. That's what we are talking about. So first of all, I want to establish here today that I'm not bringing you something new. I'm bringing you something which has already been in the market and has been used in many different forms and shapes all around the medical history. So absorbable sutures 1, HRT tablets. HRT tablets are coated by PCL in most of the scenarios. Similarly, other medical devices for limb joint replacement and stuff, they are also including PCL in them too. So if I have to talk about these polymers, first of all, why PCL? That's the question. So anybody in the house does threads? Hands up. Threads? Threads? 1. Nobody else does threads? 2, 3. So few people do threads. So if you do threads, most of the threads we are using is polydioxanone, PDO threads. So I used to do threads and love threads. When I started doing threads, I realized that actually PCL has got more stability and more index of collagenesis. Why do we not use PCL? And this is the comparison of PDO, PLLA, and PCL. So as you can clearly see, the PDO is 6 to 8 months life before it dissolves, PLLA is 14 to 18 months, and PCL is 16 to 24 months. And safety-wise, they all are high. And in terms of biodegradation period, that is the main key component. Now, the question was, how do we compare the collagenesis element? So when there was a study done between the PDO, PLLA, and PCL, what they recognized that not only PCL had the highest index of collagenesis, it had the most sustained collagenesis as well. And that is why PCL stood out for me. Now, this is exactly something I've already mentioned, that the major uses in medical devices and components, which PCL has been used for more than 90 years. And as you can see, the PCL formulation, this is something that you all would know already, but if somebody wants to go into the studies, I've given the snippets on the side. So basically, how does PCL, where does it go when you've injected or when you have put it in the body? So PCL actually breaks down just like sugar into carbon dioxide and water. Water comes through the kidney, and carbon dioxide gets excreted through the skin itself. So once we have established that, why GORI then? So GORI comes in, right? So PCL was there for 90 years. What did GORI do different? That is the question you should be asking me. What GORI did is that they fully liquidized that PCL. How did they manage to do? If you think about fillers, what they have is CMC gel, carboxymethylcellulose gel. What GORI did, they have got a patent for actually removing the CMC gel completely. So actually, in the filler scenario, the occlusion, the granulomatosis, is not caused by the actual filler, but the CMC gel carrier that is in there. So if you remove CMC gel, there is no granuloma and there is no vascular occlusion. So one of the two biggest drawbacks of any injectable, you have taken them away completely by liquidizing the stuff. Now that technology is called CESBAP technology. It's collagenesis enabled solubilized active and biodegradable polymer technologies. Oh, well, it's a mouthful. So, but you can understand what I'm saying. Collagen enabled. It enables the collagenesis. It's biodegradable. It biodegrades within the body itself, and it does not have any particles. This is the only fully liquidized and the world's first fully liquidized PCL that we have. And what that does, it gives it some unique properties. Not only it takes away those risk factors of occlusion and granulomation, it also gives a spreadability to it. So what happens if you look at a comparison picture of a liquid PCL with a microparticles polymer, you yourself would recognize that homogeneous mixture is the one more likely for us to be injecting and something that we'll be more comfortable in injecting. Well, I'll come to that. So Tashdeedul-Jild, did I say it right? That means tightening of the skin. So once we have recognized a liquid form of PCL, now I'm going to tell you what it actually does. It causes the tightening of skin. So tightening of skin is gory. That's what we normally say. So solution for skin laxity and elasticity. So what does fibroblast activation do? Gets the stimulation of collagen going on. Newly formed collagen makes a dense collagen network, filling in the little gaps and bringing those pores into a smaller size. And that what does gives a much more smoother, much more nicer outlook. Okay? Now, fine lines and pore remover. So for example, people coming to me saying, I've got a little bit of fine lines which don't even go away with Botox. So they are losing collagen. What you need to do is put some more collagen in, and that would give a bit of thickness to the skin, a bit more uniformity, and that would also help with those sort of scenarios as well. So tightening, okay. So what I say to that is, it's like a drape effect. So a lot of people asked me this question that, oh, does Gori work like a filler? Does it give a filling effect? Yes, it does give a filling effect, but it is not a volumizing agent. So what it means is, if your skeleton is the structure and the skin is the drape on it, and I pull the drape from back and tighten it, it will actually take away those wrinkles and the crevices. So it's not filling, it's actually filling effect due to the tightness. Does it make sense? Good. I'm having a couple of nods, so I think I'm making some sense, right? So this was a clinical trial that was done for the skin elasticity, and as you can see, at 4 weeks, there was a significant raise in the elasticity of the skin with Gori. Similar, if you look at the histological element, you see the thickness of the skin improving as well. And as you can see, it's clearly that there's a more uniform collagenesis, increasing the thickness of the skin, giving that more turgor to the skin and more... Is everything okay? Am I?
Si vous voyez, parce que Arthur parle très vite, Jamila est là, Jamila elle est là, elle traduira. Tiens, dis-lui d'abord lui.
Dr. Malik, you're speaking a little bit too fast.
Yeah, you're speaking too
fast.
I've got 80 slides. I'm happy to speak slow. Okay. Give me a little bit more time.
Okay.
Little bit more time.
Do it your way.
Let me run the show then. Yeah? If everybody's happy, we're happy. Yeah?
Yeah.
Dr. Jamila can translate for you.
Yeah, if there is any question, I can translate.
Yeah.
But,
so if there's any element that you want me to say slowly, just...
Yeah, you're giving a lot of information.
I'm trying to keep...
Try to not be
so,
like fast.
This is histological element in this slide that we are showing the thickness of the skin improving and increasing with the use of polycaprolactone injected through. Similarly, if I have to recap what I've told you just right now, is that inject the Gori subdermally. Gori smoothly spreads into the skin because it's particle-free. That will activate the fibroblasts. Fibroblasts will start producing the collagen. Collagen will increase the thickness of the skin and give the tightness to the skin, bringing you to the former glory. Is that the right pace?
That's clear.
Good, good, right? So now, this is again histological.
Just when you summarize, stage will like speak slowly and explain.
Jamila, on a mis la traduction maintenant.
Ah, ok.
Quelle est la traduction?
So
vous avez la traduction sur l'écran.
So collagen production increases as we use Gori at 4 to 6 weeks, and that is again shown within this slide, and you can see that there's an increase in the thickness and the dermal thickness, and contributes to creating a strong scaffold Scaffold is like a structure, so that scaffold helps the skin to remain in its place. It's like a foundation or the base. Similarly, we have other experiments that we have done and studies where crow's feet were treated by Gori. And as we can see, 0 week, 4 week to 12 weeks, the crow's feet actually improved significantly. That is why when I joined Gori with my Botox, it actually lasts much longer. And the patients have said to me that the results are way longer and way nicer. Okay? Now, so 3 S's that actually talk about Gori: spreadability, sustainability, and safety. Because it's particle-free, it actually spreads everywhere. So you do not need to target an area. So if you actually treat 2 areas, 2 vectors on the face or 3 vectors on the face, that will spread itself to the other areas. That is the amazing part. So you do not need to have a very specific technique for it. As long as you are not injecting directly into somebody's eye, you're actually doing a good job, okay? Sustainability, because I said the PCL stays in the body for much longer to actually hydrolyze. The longer it stays, the more collagenesis it causes, and that is the sustainability effect. So one full treatment lasts you for a year, which no other product does. Safety. We've already spoken about the safety element because the particle has been removed. That is why there is no granulomation and there is no vascular occlusion after 600,000 vials of Gori have been sold worldwide in over than 50 countries. Okay? Now, Gori positioning in the market is very unique. Why is it unique? Is some products produce collagen, some products are very spreadable. But one product that has got both the elements combined in one, nobody actually competes with Gori in that. So some people would ask me, there are the products which do PLLA in the market or PCL in the market. Those products do not have spreadability. And also PLLA has got less collagenesis index, which has been shown in certain studies, and I can give you the references if you need. Okay? Indications, I've already spoken about the indication as improving the skin tone, reduction of skin pores, increasing the skin hydration, firmness, elasticity, targeting the fine wrinkles, and giving a bit of a tightening effect. Actually, now there are some trials being done on melasma and hyperpigmentation where Gori has been effective. It is also being worked on dry skin conditions, atopic dermatitis and eczema as well, to help with the thickening of the skin and protect, giving a barrier to the natural barrier to the environment. Okay, so contraindications and precautions, most of them are universal and they are for almost every single injectable product. Most of the time we say pregnant, breastfeeding, immunocompromised people, or somebody who has got a hyperallergy reaction to the product. So these are the people that we actually don't treat. Some people ask me this question, why would we not treat them? Because the answer is we have not trialed them. We have not trialed it on a pregnant woman. We have not trialed it on a breastfeeding woman. We have not trialed it on these people because it's not required. So a patient has to be well to come to you for you to do it. But yes, in certain scenarios where there are some immunocompromised patients, for example, autoimmune conditions, that's where your doctor knowledge has to come in. Asthma is an autoimmune condition, right? So we don't really have to worry about that. If somebody has got a skin-related autoimmune condition and they're having an active problem and they're on a treatment at that point, that is when you don't treat. And if you think you want to, you can always write a little letter to the concerned dermatologist and ask them, this is what I'm going to do. Are you happy for me to do that? And they will probably give you the answer. Now, treatment of the face, I'm going to show that very quickly because I'm going to be doing a demo in the end. So what we really do is, in the treatment of the face, is that first I add 0.2 mils of lidocaine within the syringe of Gori. It's a 1 mil pre-filled and already prepared syringe. What 0.2 mil of lidocaine does, it just makes it a bit more convenient and easy and comfortable for the patient to have it. So where do we go in from? So the best place to go in from is go from the lateral canthus of the eye about 2.5 centimeter outwards, lateral, and that's where you make a mark, avoiding any significant obvious blood vessel. Once you are there, you are trying to make a vector towards the nasal flare and the other vector towards the mid of the marionette line. So marionette line is from the oral commissure down to the chin. The mid of that would be the mid of the marionette. So you're actually going from the same plane in a vector down towards that. Why are we doing this? Because that is enough for the gory to actually spread within this area. So it's almost spreads 4 centimeter from the area of injection. So wherever you've injected, 4 centimeter, it will spread itself. Now, similarly, for the forehead, you go above the lateral element of the eyebrow, in between the hairline and the eyebrow. So you just choose this point and go towards the mid of the forehead. There is no hard and fast rule about it. The only reason why we are telling you these vectors because they give a better spread. That's exactly why we are telling you this. There's no hard and fast rule. Even if you go reverse, it's going to work the same. The idea is the spread has to be good. So these 3 vectors are the guideline for you to understand and recognize. And no other product gives you that much of a free hand. That shows the safety element of it. Now, very, very important, I want you all to look at that little blue circle, half circle, semicircle that I'm making on every single vector. Do you understand the entry point? And then there's a little blue semicircle. That area is the no injecting zone. So what we are using is a 25 gauge, 50 millimeter cannula. You go in and you are coming out and doing a retrograde linear slow injection. But when you are doing that, you stop about 1.1 to 1.5 centimeter before the entry point. Why? I will tell you later. Okay? Remember this, you always stop injecting 1 to 1.5 centimeter before the entry point. Now, this is the general protocol that we use. But if you want to do an advanced technique, you can use the same entry point to go up into the temple area and also go down with a 3rd vector as well. So this is all your choice, the way you want to do it, as long as you're not going too close to the eye. The only reason, because there are too many little tiny blood vessels, and if you actually rupture them, you can cause a bit of a bruising. That's the only reason we don't want to go there, because it's going to spread anyways. Now, another interesting thing, if somebody has got repeated Botox on their forehead, what would happen in the long term? What would happen? Huh? Repeat Botox on the forehead? Atrophy of the muscle, right? Very nice. Atrophy of the frontalis. What that does actually signifies the underlying bony structure a lot more and makes it a bit not very pleasant looking. So gory is a natural element of giving a bit of a thickness back again. Second part, the upper eyelid that actually becomes droopy with the loss of collagen, that also will get the effect of the gory product injected here. That will go within the upper eyelid and give it a bit more turgor, and actually you will see over a period of time, it will lift the eyelid up as well. Okay? So, I've already spoken about my protocol that you already are aware of. 0.2 mil of 2% lidocaine I add to every 1 mil of the syringe. That in total makes it 1.2 mil. So 1.2 mil on one side, 1.2 mil on the other side. If I'm doing 3 vectors, it'll be 0.4, 0.4, 0.4. Similarly, 0.4, 0.4, and 0.4. That's how you would divide the dosages. Now, some of the cases. So this lady came to me. She is a middle-aged lady. As you can see, her facial structure is not bad, but her under eyes are getting a bit hollow. She's getting the nasolabials. Also, there's a flattening of the cheek. What is happening is the loss of collagen causing a bit of jowling underneath. So within 4 weeks, after doing just 1 session of gory, she had much fresher skin, much thickened skin, structure improved, a bit more volume to the volumizing effect to the cheeks that occurred. Similarly, this is one of the doctors that I work with, and she actually tried only 1 syringe, so half a mil on one side and half a mil on the other side. Wanted to see what happens to a face which is already really good. So she actually started having, if you look at this face and look at this face. So what happened was there was a bit of a tightening effect which gave a bit more silhouette to the face, and that is what she was really extremely happy with. Now, similarly, going to a bit more of an aged lady, if you look at her under eyes, they are actually quite hollow in the first picture. And if you look at the after, it kind of filled it up. Not only that, it also helped diffuse the nasolabial scenario as well. So this is a close-up of the eyes. If you look at the difference before and after, you can clearly see. Now, this sort of a lady who's a bit aged does not want, in particular, any fillers or things done to herself. Wants a natural treatment, a natural sustainable treatment. Ideal patient for this sort of a treatment. Similarly, another one of my patients coming with a bit of a tired face, generalized, looking a bit low, and then giving a bit more of a volumizing effect to the cheeks after having gory, and he was extremely happy as well. Just recently, I did another patient, this one, and she had a very good face to begin with. She's just sent me a picture about 20 minutes ago before I started this presentation today, that she was like, I'm really enjoying the effect of gory. And as you can see, her face is quite symmetrical, quite nice, but there was a bit of depletion of collagen, which you can tell and appreciate, especially under the eyes and mid-facial region, which causes the aging mainly. And now she's looking much more refreshed with a much more healthier looking skin within 6 to 8 weeks. Now, I've done the demonstration for the neck already, but I'm going to go through a little bit of things about that. So necklines are due to aging, loss of collagen and elastin, sun damage, life work, mobile users looking down on the screens all the time, genetic inheritance as well. Similarly, obesity, alcohol, drugs, smoking, hormonal changes. What that does causes lines around the neck region, and those are the lines that we are normally trying to deal with. And gory has been established to have very good effect in those scenarios, producing the collagen and giving a bit more of a diffused look to the neck. So how do we mark the neck? So basically, it's very simple. You do a diamond. It's a diamond, 3 vectors going from both sides at the margin of the sternocleidomastoid, going towards the mid of the chin toward the top, towards the notch, sternal notch towards the lower end, and in the middle, it goes horizontally to join with each other. They don't necessarily have to meet each other in the middle because it's going to spread anyways. So you just need to inject in these areas. Again, don't inject the proximal 2 centimeter area. 1 mil on one side, 1 mil on one side. Again, using 0.2 mil of lidocaine. Same cannula, same technique, retrograde linear. You can inject and will get really, really good results. Similarly, if somebody has got a double chin and they want to focus on just this area below their chin, that is when what you do is you actually do a 2 vector technique. If you draw a line between the angle of mandible from one end to the other, and then using the sternocleidomastoids as the entry points, again going 1 vector toward the mid of the chin and the other vector toward the Howard bone, that would actually give you a roughly 2 vector scenario where you can focus on this area. You can use a 1 mil syringe for both these sides, 1/2 mil and 1/2 mil. You don't need to use more than 1 mil on this scenario. I mostly choose the other diamond shaped one because that has got 2 mils and also covers for this area as well anyways. Now, want to show you some of the results that we have got. So 1 month session and we had a significant removal of those necklines. Similarly, this lady, if you can see like that, and look at this lady. She came, she had a face, neck and hand gory on 1 day. But the results of the neck, when I took the before and afters, I was really impressed. They were really, really good results. And that was only 1 session. Normally what we like to do is 1 session on day 0, 1 month later do a 2nd session. So that's how we do it. And then we can leave it for a year because the results will last you for a year. But most of my clients come back every 4 to 6 months and I do another session in between as well. Similarly, hands, when we age, our volume loss, fat reduction, lax skin, prominent veins, and prominent tendons. That all is happening in our hands. And people are very cautious of their hands these days. Oh, my face looks really nice, Dr. Malik, but my hands are looking old. Or my face is looking nice, my neck is looking old. That happens a lot. And to be fair, I always advise them on the first day, but what happens is they come to me after 4 weeks and they go, you know what, I'm very happy with my face, but I need my neck done. I need my hands done. But you want that. And that is exactly what we are working for. So hand anatomy, as you can see, 3 laminae, superficial, intermediate, and deep laminae. So what we are doing is we're trying to go between the superficial and intermediate. And we are trying to avoid any obvious blood vessels. That's all what we are doing. And we are pinching, like a tenting technique, on the, at the level of the wrist, basically, and going towards the web spaces of the hand. And similar technique of retrograde linear injections, we go with 4 vectors going towards those web spaces. And that is all that you need to do. So you can always do 1 mil on one hand, 1 mil on one hand. And trust me, the results are phenomenal. If you look at this, the same lady, the neck that you have seen off, so there is no filler involved, and you can see the rejuvenated hand is much, much better. You can appreciate that the underlying structures are actually covered, and it's all natural. None of there is a filler. No migration issue, no occlusion, no other granulomations and stuff. You are actually very safe. Similarly, another lady, as you can see the tendons being very prominent and the tendons actually being covered by the gory treatment. This lady I just did recently. You can appreciate how the results have come up very, very well. Both the hands. And what I've done also is in these patients, some people who've got really, really wrinkly knuckles. Although gory already goes and spreads into the knuckles, but you can always give microboluses within the knuckles as well, which I have done as well. And that actually makes the fingers very beautiful, very lovely. And now we are also using them for elbows, knees. It's been used for people with acne scarring, people with cellulite. After doing a bit of cellulite treatment, then you can add gory on top, producing collagen and uniforming the whole area. It's been used for intimate rejuvenation as well. So the applications are way, way beyond now. But this is something that I'm introducing to you. So right now, I'm also doing a lot of combination therapies with gory, and I'm just going to touch a little bit about that. So combination of threads and gory together gives a lift, and it's a scaffold technique that I actually published just recently in New Age, Anti-Age magazine as well. So these are some cases that I did where I actually did a combination of gory with thread lift as well. So you can see this man, the one where he looks really bad, that's when he was married. The other one is when he got divorced. So at least everybody's understanding me, yeah? And now I know. So that's how I can tell that you guys laughed. So yes, he's a very good friend of mine. I'm joking that he wasn't divorced between that. He was already a happy single guy. So yes, so as you can see, the face has rejuvenated naturally, and you can see the natural result and a much more younger looking him. And that is a result of absence of a woman and some gory. So adverse events, right? So now we need to talk about adverse effects as well. So somebody was asking me earlier on today, and I said to them, look, I've got vascular occlusion here, then I've got these granulomation here. These are the 2 biggest side effects that you can have with injectables. If I can remove them, I'm really happy. And that's exactly what gory did for me. So if you look at that, the common ones are swelling and erythema. Well, swelling and erythema, a little bit of that for a couple of days, I actually want that. I like that. Why do I like that? Because we are inducing a natural collagenesis. It's kind of an inflammation. So we want the inflammation element to be there, right? So I don't mind that as long as, you know, it goes away in a couple of days, which it does, right? That's the most common scenario that you will come across. Rarely you can get a bruising. Bruising with any injectable, when you're breaking the skin, you can cause bruising. I will tell you exactly how to prevent bruising and how to manage bruising if it happens. Very rare, vasovagal. Any injectable can cause a vasovagal. So these are the only adverse effects that we can talk about. Erythema, expected after all injectable treatments, is self-limiting and self-resolving within few hours. Similarly, swelling is the consequence of fibroblast activation. So fibroblasts are activated, so they are making collagen, and that is why it's happening. So mild swelling is expected in about 60% of the cases. It's self-resolving and self-limiting. So even if you don't do anything, it will go away. I've done more than 1,000 patients in my own practice. About 500 patients I did without doing any pre-treatment or after treatment, and the results were amazing. But in last 500 patients, what I did, I started using a bit of a cetirizine at the time of injection. What that did helped with that initial phase of swelling. So for example, if somebody's going for a wedding and says to me, oh, Dr. Malik, I'm actually going to a wedding in 2 days' time, because that's when all the women remember, you know what, in 2 days' time I'm going to a wedding, I need a treatment. So that's when you would say, okay, let's give you some cetirizine and make sure that you are okay with it. And in certain cases, I even gave prednisolone, because I was like, okay, they really are worried, they're going on a holiday, they want to look really good, so give them a little bit of 30 milligram of prednisolone just to make sure that they are okay. But apart from that, even if you don't do anything, it won't really affect the results, it won't affect anything else, okay? Similarly, this is a case where there was a generalized swelling, and then the swelling goes away automatically without the treatment of any sort. So 4th day recovery, full recovery, back to normality. Now, bruising. Now, let me remind you with bruising is very much dependent on your hand, how you inject, right? So if somebody is injecting and actually screwing the whole cannula in, they will cause bruising. You need to be very, very gentle and have a finesse in your hand, because you are artists. You are like artists of the aesthetic world. And that is why how you go in, how you approach. Now you remember the semicircles that I was talking about? The semicircles on the marked faces? Those semicircles were not to inject. Why? Because you're making an entry point and you're making a bleeder there. So if you inject there, you're mixing the product with the blood. So try not to do that. If there is some extraordinary bleeding from an entry point, try another entry point. That's it. So that's one thing that you can do straight away. Always, lidocaine is used sometimes near the entry points. That is also a vasodilator and can cause a bit more of a bleed. But if you use epinephrine with it, then it causes vasoconstriction and causes the bleeding to be less. Okay? Similarly, if there is a sense of bruising that you feel, okay, I've done it, and I feel like there could be a bit of a bruise, what do? The first thing to do is put pressure on it. Second thing to do is put ice pack on it, because that is the bleeding time.
Dr. Malik, 8 minutes left.
Yeah.
So think of the demo, please.
You slowed me down, man. Sorry. So I was going for aspa. Okay, it's going to be quick. So basically, if there is a bleeding, you're going to cause vasoconstriction by ice packs, and you stop it. If the bleeding has occurred after 2 days, you then use a heat pack. So heat pack comes after 2 days. Similarly, arnica cream, vitamin K cream, bromelain, normal saline, infiltration, tranexamic acid, mesotherapy, and Pico laser if the bruise is not going. These are the things that you can do. This is the management of a bruise for any element, not just with gory or anything. So this is what I established for you guys to look at and be aware of. So this is the kind of a message you want to get from your patient, right? This is my actual patient. She is a lovely lady. She said, wanted to show off my cheeks and the gory effect, the sculpture, and in love with myself. Well, most of the women are, but yes, this is what I want to establish. This is the kind of a message I get a lot, because after 4 to 6 weeks, when the collagen is established, the lady gets up, goes to the mirror, and she looks at herself and she goes, I look good. And that's when she goes, Dr. Malik did something right, you know, send him a message. And that is when you get this message. Anyways, gory has internationally gone from place to place, more than 50 countries. And as you can see, there are multiple papers and multiple journals it's been published in. I had my own publication that came to Anti-Age magazine, which I'm going to give a reference for. All these countries I've been to already, training gory, and been received amazingly. This was at IMCAS. I was given the award for outstanding work for gory as well. And this was my Anti-Age magazine article that if anybody's interested, please do search it and have a look. Shukran lakum, Jamia.
Thank you. Thank you so much, Dr. Dori.
Dr. Malik bringing you gorgeous Gori to a gorgeous country and gorgeous people.
Thank you, Dr. Gori. Maybe you can take
I'll do that.
1 or 2 questions from the audience. I don't know if you have
Any
enough
questions?
time. Y a-t-il des questions? Oui.
Is she ready?
I think there is other technique of injection with 5 points, maybe.
So that was the old technique. So initially there was a technique like a BAP technique, you know, the one we do with Profilo. So we did points. But what happened is that over a period of time when it developed more, they realized that the spread was even better with the cannula technique. So that's why.
And I didn't understand why, if a product is mixed with the
Lidocaine.
no, with the blood, it's not good.
So,
What's the mechanism?
so the mechanism is this, that for example, if you are doing somebody a permanent filler, right? And while you're injecting a permanent filler, the person starts bleeding a lot in that area. And you actually still inject it there. You have mixed the blood with the permanent filler, haven't you? So the permanent filler is going to stay forever. So what are you going to do? You're going to cause a problem, isn't it? So idea is, even if you're doing any fillers or anything, whenever there is a bleed, you try to stop. You don't do that area. Okay? So you stop that. So idea is only this, the PCL will take a longer time to dissolve. So you don't want to mix blood with that. Simple as that. Okay? Any questions?
Yes, please.
I'm going to do the demonstration. You guys can see the
One more
demonstration.
On passe tout de suite à à la partie pratique.
One question? Yeah,
please.
One
go on.
other question.
Hello.
Hello. So I have one question about the dilution. So you talked about the lidocaine and the saline. So it's 2 options, either lidocaine or the saline, right?
Saline. No. So yeah, let me explain you all. The question is really, really good. Doctor has asked the dilution with
please,
lidocaine
s'il vous plaît.
or saline. So basically, there is no need to dilute with saline. It doesn't affect in any way, right? It's already pre-filled and prepared stuff. Even if you don't put lidocaine, it will still work. The only thing will happen, they will have a little bit of a sting when you're injecting. But when you add lidocaine, I realized that, you know, the pain went down to 1 out of 10.
Okay.
So that is the reason why.
And it's like 1 each side.
1 mil on each
syringe.
side. So I'm going to do it now.
Okay.
You will see exactly how I do it.
Okay.
On va
Is that
passer
okay?
tout de suite à l'injection pour gagner un peu
Yeah.
de temps parce qu'on est déjà en retard.
Hello. Right. So. Nice. Do I have to? I'm very hot. Leave it. Leave it. I'm very hot. Everybody can hear me? Yeah? Okay. So we've got this lovely lady. What's your name?
Maria.
Maria. Lovely lady Maria. And we have taken some pictures beforehand. Perfect.
No, they didn't.
They didn't? If you sit up for me, please. So if you look at Maria's face,
Please, we don't see our patient.
if you look at Maria's face, we can establish.
Excuse me, Dr. Gary, because we don't see your patient. Yeah, no.
Yeah. Human blood. I'm so hot.
You want me to prepare something for you?
No, I'll have to show them. I'll have to show them. Where's the lidocaine? This one. Have you got a pen? Is there a pen? Okay. Go. Hello. So, as we have got this lovely Maria here today, so we can see Maria's face, and she is probably, how old are you, if you don't mind me asking? How old are you?
I have understood. I might, but I can tell you because I'm happy and proud of this.
Okay.
I am 60, almost 61.
She's amazing. She looks amazing for her age, to be fair. And as you can see, that she has got a little bit of fine wrinkling here and some static lines here. a little bit of jowling is starting to appear. So she's kind of a candidate who would actually benefit with something like Gauri very, very well, because that's going to give an overall lovely appearance. And actually, by the end of my treatment, you will already see the difference in the mid-face being raised. Okay? So what we do is we just clean up the face first, and then we mark it. So I like to quickly clean up the forehead area and the mid-face area where I'm going to be injecting. Okay, and let's mark it up. So lateral canthus of the eye is here. I can feel it. And from here about 2 centimeters out, going towards the nasal flare would go like this, and going towards, this is the marionette line, this is the mid of the marionette line. So if I was going there, this would be like this. So that would be my trajectory of 2 vectors. Now, if I want to do a separate one for the forehead, this is the lateral element of the eyebrow, and this is the hairline. Somewhere in between will be my entry point, and from here, I try to go towards the mid of the forehead. Now, this is how there are 2 entry points mechanism. But if I want to do with advanced technique, and I want to do from here to the forehead, I would use the same entry point, and I will go like that. So that would have the similar effect instead of me having 2 separate entry points altogether. For hands and for the neck, I like to do a bleb of lidocaine for the entry point, but for the face, I actually like to go straight ahead. Similarly, on the other side, lateral canthus of the eye, about 2 to 2.5 centimeter out. Then from here, going towards the nasal flare and going towards the mid of the marionette. So that would do the trick. Okay? Similarly, in between the eyebrow and the hairline, you just go like that. So the whole face is marked. Thank you. Come down for me, please. Lie down. So now I'm going to show you how to prepare the product. So Gauri comes in a pre-filled 1 ml syringe, and as packaging, okay. So this is Gauri, right? It comes in this pack. When you take it out, it's like a pre-filled 1 ml syringe. As you can see, it's a milky, homogeneous fluid. Once you have taken that, I usually get the 50 millimeter cannula with the trocar, 25 gauge, and use the trocar itself to bring some lidocaine in the action. So this is the lidocaine 2%. So I will just get 0.2 mils estimated lidocaine from there. So this has gone in. So because it's homogeneous mixture, it just very easily mixes. You just need to slightly shake it, and that's it. So this one is now ready to inject. Similarly, for the other one, there one. So other one of the Gauris, because 1 mil for the one side and 1 mil for the other side. Again, this is the product. We open it, we connect with the trocar, and get 0.2 mils of the product, of the lidocaine into the product. So what that has given us is 2 prepared syringes of Gauri ready for each side. So now I connect my 25 gauge 50 millimeter cannula, which is this, and now we are ready to rumble. Okay? So if you just look to your left side, perfect. So this is my entry point. Can we lower the bed a bit? Just lower it down a bit, the whole bed. Yeah. Perfect. Yeah? So as you can see, this is the entry point. Now, I got this trocar, and I just gently pinch it a couple of times and just make a little entry point. As soon as I've done that, So I will have an axis. As you can see, I've got the axis. I've gone in very smoothly, and I'm going towards the nasal flare, and I can feel the tip of the cannula here, subdermally. I push the skin up a little bit, just so that, I get a better approach. So I've got 3 vectors, and I've got 0.4 mils to inject in every vector. So as I'm injecting, I'm coming out. As I'm injecting, I'm coming out. As I'm injecting, I'm coming out. Yeah? Now, I have not injected this 2 centimeter of the vector. Then I come out a little bit more. I turn from the same entry point towards the lower end of the face. And I go same technique, retrograde linear, coming out 0.4. So I sometimes choose to inject a little bit more on the mid-face area than the forehead, because that actually, if there's more need of rejuvenation in this area. So I can do that as well sometimes. So I'm happy. Overall, I'm happy. And if I want a 3rd vector, I can just do a little bit on this 3rd vector. But this is done. So now this area of the mid-face is done. No, I'm fine. I'm fine. If I have to do the forehead, this is the entry point. There's an obvious blood vessel here. I'm slightly going to go a bit more inferior to that. And as you can see, I have very gently made the entry point through. Sometimes they're very difficult to see because it's a fine one, but as we can see, it's gone in. So it's a one-hand procedure if done right. So your depth should be okay, and here you go. Perfect. Now I'm injecting, and I'm coming out, and done. So one whole side of the face and the forehead has been completed now. Now we ask the lady, as you can see already, there's a bit of a lift on the mid-face and the mid-cheek region, and that is beautiful. So now on the other side, we connect the other element of the cannula. And we're going to repeat the same thing. So now I'm going to show you how I would do it in my clinic. So now you know the explanation of everything. So how quick and easy the methodology is. So if I can just have the trolley next to me a bit. So here you go. Pinching, going in, coming out. And as you can see, gone in, and towards the nasal flare, I'm going to go do about 0.4 mils here, and then not injecting the initial part, then changing the direction, going towards the mid of the marionette. I'm injecting and coming out, and I'm going to leave about 0.3 mils. Perfect, I've done. And this side now, I'm going to go from the same entry point, instead of making a new one, into the temple. As you can see, from the same entry point, I've gone here, right? And now I'm going to start injecting, and you can see it's all injected from the same entry point. So this is how long it takes to do one side of the face, and both sides are now done. There's no need to massage. It will dissipate itself and spread through the face, and that's when you just clean the patient and put some arnica on the entry points and tell them to come within 4 weeks for a review, and then you do a top-up session. Thank you so very much, Maria. Thanks a lot.
Donc, je remercie le docteur Malik pour sa brillante présentation et je vous invite à poser des questions, s'il vous plaît.
Yeah.
Is there any pills or medicament to avoid to have more beneficial results, like antioxidants, corticoid? There is other pills to avoid?
Place to avoid?
Yes.
No, there's, apart from the fact that you don't cause a bleeding, everything else is okay.
We don't ask.
No, all good, all good. We have some doctors do, it's such a safe product that so many doctors have created their own methodology as well over a period of time. So some of the doctors actually go reverse vectors. So what they do, they have an entry point here, and they do the same thing reverse as well. Some people actually like to do a bit of micro boluses within the marionettes or the nasolabials as well. So it's such a safe product that can be done in that way. Oh, for the swelling,
Yes, you didn't write, for example, corticosteroid. Why?
Didn't write corticoin.
There's a
Hydrocortisone, right. So I explained in my lecture, I was talking about that. So for example, the only time out of 1,000 patients that I've treated, I had to use hydrocortisone was this, when a patient came and said, listen, I don't want any swelling, tomorrow there is a wedding. I'm going to the wedding, I need this. Okay, fine, 30 milligram prednisolone, given them on the day, done. Khalas. We don't use it. Yes, we need inflammation. The only reason we use it if the patient comes and says, you know, but if you actually look at the inflammatory response, you'll understand that at 6 to 7 days, there is a secondary inflammatory response that occurs. So you will still have that without the swelling. Okay? All good? Thank you. Thank you so very much. Cheers.
Docteur Malik.
Donc, sans plus attendre, j'invite le docteur Jamila Athanase à présenter l'exploration des structures sous-cutanées et interventions ciblées, anatomie, échographie et injection, une triade essentielle pour des résultats sûrs et précis. Je vous remercie, docteur Athanase.
On va donner son trophée au docteur Malik. Dance?
Yeah.
We will dance?
Yeah, dance.
So, okay.
Music?
Music. Donne la musique.
I was joking. She's serious.
Présente. Je plaisante. Il est pas je plaisante pas.
I'll do it.
Dire-nous la musique à effet.
Who's going to join
Music.
them? We need to join in some people. Yeah. Can I do it? I would really like to thank this amazing team here, especially all these people. They have been amazing and so loving. I almost feel like I'm with a family, you know, like she's such a lovely person to be around. And Hamza as well, and all of these people, they have been absolutely helpful, and I really can't wait to come again to Morocco again as well.
Non, moi je sais pas. Et on l'est.
Bravo.